this video, I'll be showing you an Invisalign open bite closure in an 8-year-old. This is different than my previous videos about open bite closure for a 50-year-old, 40-year-old, 20-year-old. This one's an 8-year-old. We definitely like to take care of this issue early because of the tongue thrusting, growth issues, and also speech. The earlier you can correct an open bite, the better it is for the patient. So here we go. Hey guys, this is Dr. Robert Passamano. I'm a board certified orthodontist. Today we're going to be talking about open bite closure for kids. That's usually between the ages of 7 and 15 years old. You can see we've done many open bite closures using Invisalign. This is a previous video that I went over. She had a 6mm open bite close. This one's a lateral open bite. This is about a 3mm lateral open bite close. Then we have complete closure of the open bite. And this was done in a 48-year-old female. We have a 26-year-old female for anterior open bite closure. And then this one, we had an 11-year-old male for open bite closure again, also with Invisalign. All of these have been done with Invisalign. And so why do open bites occur in the first place? It could be a variety of different reasons. Pacifier, thumb sucking, large tonsils and adenoids, a narrow maxilla. All of those can result in mouth breathing, tongue thrusting, speech issues like lisping, eating issues, inability to bite certain foods, and as well as vertical growth. That's the long face, meaning that if you are growing more vertical, you have a longer face, and your face is also a little bit more scrunched together like this. The treatment for this historically has been extraction of teeth. Usually you take out 4 teeth, jaw surgery, and more recently is Invisalign. For the past, I'd say about almost 2 decades, Invisalign is the clear choice for open bite closure, and we're going into detail about this 8-year-old now. This 8-year-old patient presents with an anterior open bite of 3 to 6 millimeters. You can see about 3 millimeters in the front teeth, 6 millimeters in the side teeth. She has a narrow upper jaw as well as a vertical jaw angle. I'll show you on the cephalometric x-ray what that means. This has all resulted in difficulty chewing, swallowing, speaking, especially the S's and the T's. That's lisping, as well as tongue thrusting. Every time she swallows, she has to push her tongue forward to create that negative seal. So the question is, do you do the myofunctional therapy now or you do the myofunctional therapy after the orthodontic treatment? It's my opinion to do the myofunctional therapy after the teeth are aligned. You want to take care of the hard tissue before you do the soft tissue. Soft tissue is all about training. Hard tissue is all about functional movement. So of course, my opinion is going to be close the anterior open bite, and then this patient can do the myofunctional therapy later. This is the lateral cephalometric x-ray for this open bite patient. She has a very hyperdivergent jaw angle. That's the mandibular plane angle. She has a 39.6 degree. Average is supposed to be 21 degrees, so we're about 18 degrees more than normal. This means that she is more of a vertical grower, a long face. Ideally, we want to make the face go more normal or decrease the vertical growth. We can do that by intruding the posterior teeth rather than extruding the anterior teeth. If our goal was to only extrude the anterior teeth, then there would be no change in the jaw hyperdivergence. But for this patient, because she is growing, we want to get her back closer to normal. And so therefore, intrusion of the posterior teeth will get the best result. Here's the before and after of the Invisalign open bite closure. You can see that the 3 to 6 millimeter open bite has been closed. We did that without opening up the jaw angle anymore. You can see that the jaw angle actually looks like it's been decreased, which was the goal I was going for. The chin position is no longer as vertical as it used to be. So this is a much more pleasing smile. This patient can swallow and speak a lot better now. The S's and the T's sound great. She can also proceed with her myofunctional therapy treatment at this time. Let's do a quick recap of this Invisalign anterior open bite closure for this 8-year-old patient. She presented with a 3 to 6 millimeter anterior open bite, hyperdivergent jaw angle, difficulty speaking and swallowing. Using the Invisalign mechanics, intrusion of the posterior teeth, we're able to decrease the anterior face height, making it a more pleasing smile and appearance of the jaw. The open bites are closed. This patient can now speak a lot better. Now she can proceed with her myofunctional therapy. This is a great case to show what Invisalign can do for any phase 1 patient or even a phase 2 patient that's usually between 7 and 15 years old. Thank you guys for watching this anterior open bite closure for an 8-year-old patient using Invisalign First or Invisalign Phase 1. Invisalign is my go-to for all open bites. It works great. You guys have already seen my results. I absolutely love doing this, sometimes even more than braces. If you guys want to watch other videos on Invisalign, check out my Invisalign playlist. And don't forget to like and subscribe, and I'll see you on the next one.